Thank you for the opportunity to present. In early 2024, the FDA granted full approval for the Gore excluder TAMB. It served as the first off-the-shelf endovascular solution for treatment of complex aneurysmal disease involving the visceral aorta. Per IFU, it is indicated for repair in patients with thoracoabdominal aneurysms and high-risk surgical patients with pararenal aortic aneurysms. TAMB is a modular device consisting of various components, as Dr. McKinsey taught us about earlier today. The aortic and branch components can be challenging to position, orient, and deploy. Previously, endovascular options were limited to custom-made endografts that required lead time to produce and had more stringent indications for use. Parallel stent grafts that resulted in high rates of endoleaks or physician-modified endografts. Given the novelty of this device, there is limited literature describing techniques that can be used to improve outcomes of TAMB cases. We examined a case series of patients where 3D printing of the aorta and cone beam CT were used as adjunctive maneuvers for TAMB cases. The case series consisted of 10 patients who underwent aortic repair with TAMB from November 2024 to July 2025. Each patient had their aorta 3D printed preoperatively based on reconstruction from CT angiography. The 3D printed model was used for preoperative case planning. Intraoperatively, each patient underwent cone beam CT using the floor-mounted C-arm in our hybrid operating room. The scan was performed after deployment of all stent components and was used to assess the quality of repair. Seven of the 10 patients were treated for a thoracoabdominal aneurysm. 3 were treated for high-risk juxtarenal aneurysms. 70% of the patients were male. 70% of the patients had coronary artery disease, hypertension, and history of tobacco use. 2 patients had COPD, and 1 patient had CKD. 3 patients had prior aortic interventions, such as a TEVAR, as part of a staged approach. All patients had preoperative lumbar drains placed. So as previously mentioned, each patient had a 3D model of their aorta created. Benefits of 3D printing the aorta preoperatively included a more streamlined deployment plan, as well as improved precision and accuracy during deployment. This was a result of being able to predict challenges with positioning of the device, especially in an aorta with significant angulation, and to predict challenges with cannulation. The models allowed for visualization of what cannulation and what wire access of the visceral vessels would appear like in an ex vivo setting. Each patient also underwent cone beam CT as recommended by Gore. One main benefit of using cone beam CT intraoperatively was allowing for real-time assessment of stent deployment within the visceral vessels, aorta, and iliac arteries. We can assess for appropriate positioning, overlap, and sizing of the stents using the cone beam CT. Of the 10 patients in this case series, 2 patients required further intervention following their intraoperative scan. 1 patient had compression of the celiac artery by the SMA, which required further ballooning of the celiac and SMA stents with kissing balloons. Another patient required deployment of an additional left renal artery stent to address a potential kink. Both patients had improvement in resolution of the identified issues following re-intervention. Overall, our outcomes showed relatively good success. Average length of stay was 7.5 days. 9 of the 10 patients were discharged home and 1 discharged to rehab. There were no perioperative deaths and 0 mortalities are noted for. We had 2 patient complications. 1 patient was reintubated post-op day 2. There was also 1 patient with loss of 1 branch stent patency. 1 patient had a left renal artery, which was no longer patent post-op. These results show that 39 of 40 visceral stents that were placed in our case series were patent on follow-up. This was a real-world experience using 2 adjunctive maneuvers after FDA approval. Use of preoperative 3D printing and intraoperative cone beam CT has shown to have significant benefit in complex endovascular aortic cases based on our case series. 3D printing helps to determine if the device will take an angulation of an aorta with severe angulation. Cone beam CT has shown promising results for enhancing branch and graft patency by identifying technical problems early on. If institutional resources allow for it, these adjunctive maneuvers should be routinely used for TAMB cases, and especially in those patients with challenging anatomical considerations.